Hi Regina, my name is Vanessa. I'll be your massage therapy student today.
Hi.
So we're just going to go over a basic health history form here so I have a little bit more info and see what medication and stuff you're on. As well as we're going to do some interview questions, just some pain questions so I can see maybe where your pain's coming from, maybe if it's your sleeping position or something like that. So I'm just going to go through this here. So I noticed that you still live at 69 Boogie Boulevard?
Yep.
In Barrie?
Yep.
Okay. And your occupation is a cashier and a student? Okay. And I see that your primary complaint today is neck pain.
Yep.
So we'll definitely address that and see make a treatment plan for that. And your overall health level is good?
Yeah, I'd say it's good.
Okay. So I'm just going to go through a couple conditions here. I noticed that you haven't crossed any off, but I just want to go through them to make sure maybe you didn't miss any. So in respiratory, so you don't have any chronic cough, shortness of breath, asthma, anything like that? Okay. And cardiovascular, so any high blood pressure, low blood pressure?
No.
Okay. And infection, so hepatitis, TB, HIV?
Nope.
And skin, so any rashes, athlete's foot or warts or anything?
No.
And other conditions, so loss of sensation, diabetes, arthritis, cancer?
No.
Any family history with any of those?
No.
Okay. And head and neck, so you don't have any vision loss, vision problems, or you don't wear glasses or anything?
No, I don't.
Okay. So then I notice here in soft tissue and joint discomfort, you did check off neck. I notice that you have some pain and tightness is what you've written down here.
Yeah.
Okay. So I see here that you're on naproxen for pain and inflammation. Have you taken any in the last 24 to 48 hours?
No.
Okay, just want to make sure so if I have to modify my treatment or anything that it's okay for you. So that's good there. So we'll just go over some questions here and I'll just get you to just give me the best answer you can. If you don't know how to answer it, I can try and reword it a little better for you. So what position do you normally sleep in at night?
I usually say my side or my stomach.
Okay, and what are some of your hobbies?
I like to ski and I like to read.
Okay, do you have any issues with your jaw at all that maybe that you know of?
No, I don't.
No?
No.
And what is your lifestyle outside of work and school?
I'm usually on the computer and reading a lot because I'm studying.
Okay. What are your eating patterns like? Do you eat a lot of salty food or do you eat pretty general, like healthy?
I'd say I eat some pretty salty foods like 1 or 2 times a week.
Okay. And have you experienced any physical traumas or anything?
No.
No? And how long have you been experiencing this neck pain that you've had?
It's been a couple days, but it's started to get worse.
Okay. So I'm just going to ask you a couple pain questions just to kind of see maybe how your pain's affecting you, what type of pain it may be, so maybe I can figure out maybe more what the issue is for your neck there.
Okay.
So how long does the pain usually last for?
It hurts like all the time when it's happening, but it gets better if I take like an Advil or medication for it.
Okay. And how would you describe your pain?
Tight, like aching, it kind of feels hot and like broad, like it's the whole side of my neck.
Okay. And on a scale of 1 to 10, as 10 being the worst pain you've ever experienced and 1 being the least amount of pain, what would you rate your pain?
Definitely an 8.
An 8 out of 10, okay. And if you could maybe show me like where it hurts on, like where does it hurt on your?
Like the whole side of my neck.
The whole side of your neck, okay.
Yeah.
Is there anything that makes the pain worse?
Like trying to do fast movements with my head, like, yeah.
Anything that makes it feel better?
Medication and rest.
Okay.
Definitely.
And do you get any radiation or referral pain anywhere, or is it generally just stay in one spot?
It's generally in one spot.
Okay. And do you experience this often?
No, I've never experienced it before.
Okay. So we finished up there. So what we're going to do now is we're going to do some quick assessments. So we're just going to do a couple special tests on you, maybe to see what causes pain, what doesn't cause pain.
Okay.
And then after that, we'll get to the treatment and we'll do a quick consent for that as well.
Perfect.
Okay?
We're just going to do a brief consent. First we're going to do some range of motion. I'm just going to get you at first to follow my movements, and then I'll do them for you without you putting in any sort of input. We're not going to do resisted right now because you're not supposed to do it until the spasm has reduced. We might just do it after treatment. Next, we're going to go through some functional assessments just to see if you have any sort of incapability of doing activities of your daily life. We're going to do a quick neck disability index, just to see what your pain is like, kind of thing.
Okay.
And then next we'll do some special tests, and then we'll just do some quick palpations, okay? So first, do I have your consent to do this?
Yeah.
Okay, so we're just going to do some range of motion. I'll just get you to follow my actions, okay?
Okay.
So first, and before I forget, just make sure that you let me know if you have any pain or discomfort while you're doing any of these, okay?
Okay.
Okay, so first I'll just get you to bend your neck forward into flexion. Okay, any pain or discomfort?
Discomfort.
Okay. Next, I'll get you to bend your head to the side.
That hurts.
Okay. And to the other side.
That's just uncomfortable.
Okay. Next, I'll get you to extend your head backwards. Any pain or discomfort with that?
Pain.
Okay. And I'll get you to do rotation. First to the side that is affected. Pain or discomfort?
Pain.
Okay. And next to the other side.
Just discomfort.
Okay. Next, I'll just ask you some questions. Oh, no, I'll do it passively. Okay, so I'll just get you to lie with your head just slightly off the table, okay? Okay, and so let me know if you have any pain or discomfort with any of these, okay?
Okay.
So, flexion. Any pain or discomfort?
Discomfort.
Okay. Extension. Any pain with that?
Pain.
Okay. Any pain or discomfort there?
Just discomfort.
And then over to the side.
Pain.
Okay. Next, I'll just rotate your head. Pain or discomfort there?
Discomfort.
Okay. Any pain or discomfort there?
Pain.
Okay. And that's that. I won't do resisted on you like I said before. I'm just going to ask you some questions about your daily life. So when you're eating or grooming yourself, brushing your hair, brushing your teeth, things like that, driving, do you have any incapabilities to do anything required with those sort of activities?
Yeah, I can't check my blind spot. Brushing my hair and brushing my teeth is difficult. And reading is difficult. And it obviously makes me sad that I can't do things that I would do usually every day.
Okay, so it causes you a little bit of, depression because you're not able to complete your activities of daily living like you normally would. Okay. Can you just show me quickly, how you would brush your hair?
So I would go this side and I can't really do it, and then I would switch sides and I can't really get the range of motion.
Okay, so you basically just have a problem turning your head side to side when you're trying to brush your hair.
And my teeth.
Okay, and your teeth?
Yeah.
And when you check your blind spot, obviously looking over your shoulder causes some discomfort.
Yeah.
We're just going to go through a quick neck disability index.
Okay.
I won't do everything on here because it can take a little bit of time, but I'll just ask you briefly. So your pain intensity, would you say you have no pain at the moment? It's moderate, it's mild, or it's pretty severe?
I'd say it's like mild to severe.
Okay. So lifting, do you find that you can lift heavy objects without it causing you any extra pain? Would you say that it causes you some extra pain but you're still capable? Or would you say that you can't really lift heavy things?
I can't really lift everything.
Okay. You said you like to read a lot.
Mm-hmm.
So can you find that you can read as much as you want to without any pain in your neck?
No. It's definitely painful.
Okay. So in regards to headaches, would you say that this isn't causing you any headaches? It's causing you moderate painful headaches, which come infrequently, or would you say it's causing you headaches that come pretty frequently?
I don't think it's causing headaches, no.
Okay. How would you say that it affects your concentration? Do you still have full concentration when you're doing something? Is it slightly decreased your concentration, or would you say that you can hardly concentrate on anything?
I'd say it's slightly decreased just because the pain makes it hard to concentrate at times.
Okay. Okay. So next we're just going to do some special tests.
Okay.
We're going to start with the vertebral artery test. I'm just going to get you to lie face up on the table, and I'm just going to move your head into extension, rotation, and lateral flexion. And I'm going to hold it there for 30 seconds, and let me know if you have any change in symptoms. You get nausea, or vision problems, or hearing problems, things like that, okay?
Alright.
Okay. So just get you to lie down. So move your head into extension, rotation, and subflexion, and I'll hold it there, okay? Any change of symptoms?
Nope.
Okay, and I'm just going to do it to the other side. Any change in symptoms on that side?
Nope.
Okay, awesome. Next, we're going to do a compression and distraction test. I'll just get you to sit on the chair.
Okay.
And first, I'm going to just push lightly down on your head. I'll get you to, we'll just turn it to the side. And I'm going to push lightly down. And let me know if your pain increases, okay?
Okay.
Any increase in pain?
Nope.
Okay, I'm just going to turn it to the other side. Any increase in pain?
Nope.
Okay, and then I'll just keep your head straight. And then now I'm just going to do a distractor test. So I'm just going to lightly lift your head and let me know if this relieves your pain, okay?
Okay.
Any relief at all?
No.
Okay. So now I'm just going to do some quick palpation.
Okay.
I'll start on your traps just to see if I can find maybe any trigger points that are in there. Okay. And then I'll palpate your anterior chest, both sides. And I'll palpate your neck to see if there's any signs of inflammation like edema or heat or redness and things like that. Okay, and there is some heat and some edema on your affected side. Next, we're going to move on to the treatment portion. So I'll just get you to lie on the table, face up, with your head slightly on the table, and we'll move on to the treatment.
Okay. Now we're going to be moving on to the treatment portion. So basically, I'm going to have you supine. We're going to be undraping just your neck, shoulders, and upper chest area. So we're going to be working on your upper chest, your shoulders, and your neck area. We're going to decrease the pain in your spasm. We're going to decrease the pain in your caused by your trigger points, hopefully to a 3 out of 10, because your pain right now is sitting at about an 8 out of 10. We're also going to try and decrease any fascial adhesions that you may have in your upper chest that may lead to resisted or limited range of motion. So basically, we'll be leaving the painful techniques out today, just because you are in a spasm still. Benefits to having this treatment would be reduction in pain and spasm, hopefully. Not getting the treatment will just prolong your symptoms and possibly make them worse. There isn't any potential risk to make your treatment worse. However, I will be watching out for your carotid artery and any painful movements. Do you have any questions? And do I have your consent to treat?
Yep.
Okay. So I'm going to let you get undressed to your comfort level, laying supine, so face up on the table in between the sheets. I will knock before I come back in and make sure that you're ready and comfortable. And do you have any questions before I go? No? Okay, perfect. Hello, Vanessa. Are you on the table?
Yep.
Are you in between the sheets?
Yep.
Is it okay if I come in?
Yep.
just going to fix the sheets quickly here. Are you comfortable?
Yep.
Did you want me to move the pillow at all?
Nope.
No? Okay, perfect.
Okay.
Some lotion. Okay, so I'm going to drape now. Is that okay?
Mm-hmm.
If you just want to take your arms and put these straight up for me, perfect. Perfect. Okay. First, what I'm going to do is warm up the tissue. Next, I'm going to assess the fascia. I'm going to do a myofascial release. I'm going to treat the unaffected side first. And then I'm going to treat the affected side. Okay. I can go back to the unaffected side and do some skin rolling. On the upper tracts, as well as on the unaffected side, or on the affected side. Some skin rolling. Okay, next I'm going to decrease pain in the trigger points. So first I'm going to locate a trigger point in upper trapezius. And when you find the trigger point, I'm going to look for two things. I'm going to either look for a twitch response, or I'm going to look for tenderness and pain, or I'm going to look for referral pain. So when I found the trigger point, first I'm going to do a compression on the trigger point. Next, I can do muscle stripping from end to end. So I would start laterally and move in medially, stripping the muscle fiber. And to finish, I would apply heat and I would apply a stretch. Okay. Okay, so next we're going to reduce the muscle spasm in your neck and also reduce pain at the same time. So we're going to treat the affected side where the muscle spasm is. I'm going to find SCM or sternocleidomastoid. I'm going to find the tendon, and I'm just going to bow it to the side to add tension on the muscle to let the muscle know that it's time to release. We'll hold that for a few seconds. And then I can also do origin and insertion on the tendons. So just compressing into the tendon and doing like T-strokes. And then to reduce pain with the spasm, you can do stroking on the muscle belly. Or fine vibes. Okay, so we're going to talk about some home care today so that hopefully it can help your condition, not worsen it. So what you can do for your neck is some active range of motion. So just like moving through the ranges like this, but pain-free. You can also do some diaphragmatic breathing. So that's just like breathing in like right through to your belly and holding it for 10 seconds. Sleeping positions and posture, definitely you don't want to be slouching over like this or looking up for too long. You want to try and sleep with your neck in a neutral position, so not like cranked over like this or like, yeah, just in like a neutral position. You can also do some gentle stretching, so again like pain-free. So like if you just want to like stretch like to the side like this or whatever you're comfortable doing. You can also bounce gently, like if you have one of those like big exercise balls, you can bounce gently on the ball. It kind of stimulates the activity that your muscle should be having, so that should help as well. And then also if you have time, you can take like a little ball and kind of just put it on the wall. And so then put your head against it, so you're holding the ball against the wall and kind of just start to turn your head as much as you can pain-free, and that'll help with your like rotation of your head. And then you can always use hydrotherapy, so heat. I'd suggest putting it on for 10 minutes at a time, maybe 3 times a day for like a week at a time, or sorry, like try that for a week. And yeah, do you have any questions?
Nope.